Hello, good morning to all of you. I am Dr. Mukesh Vijay, Senior Urologist Consultant in Kothari Medical Center in Alipur, Kolkata. Now, today we are talking about the CA prostate. CA prostate or carcinoma of prostate is a malignant disease of the prostate, and it is a cancerous disease, and this is arising from the prostate cancer, that is the male genital organ. It is situated just below the bladder neck and the proximal part of our urinary tract or urethra. It is giving the symptoms like normal enlargement of the prostate, that are the frequency, urgency, obstruction in urinary flow, sometimes bleeding, and sometimes it may be cause the urinary obstruction leading to the increase in the urea creatinine and impairment of the renal functions. But usually the prostate cancer itself is not giving the symptoms. This prostate cancer is normal enlargement of a normal enlargement of the prostate give the symptom of the prostatic obstruction, and usually patients come in the elderly age groups, but it may be occur in the younger age group if there is a familiar history of prostate cancer in their families, like their grandparents or in their father. So that we are usually diagnose it by doing the digital rectal examination. In digital rectal examination, we are usually found the hard prostate or a hard nodular prostate on examination. Apart from that, we are doing the serum PSA. In the PSA is raised in the CA prostate, but the PSA is also raised in some other benign conditions like infection, tuberculosis, some trauma to the prostate. For that, we should confirm that the PSA is very high and our clinical finding in the digital rectal examination is suggestive of CA prostate. The confirmation of the prostate cancer by the prostatic biopsy that we are doing with transrectal ultrasonography guided prostatic biopsy. In the prostate biopsy we are doing, apart from that, we can also do the CT scan and the MRI. Usually we are prefer the MRI. That is also we give us some suggestions of it may be a prostate cancer. But our mainstay of diagnosis is the prostate biopsy through transrectal ultrasonography, that is TRUS guided prostatic biopsy. In the some patient, the PSA may be raised to more than 100, 75 or 300. It is more likely to be raised because of the CA prostate. But some patients have a prostate PSA is between 4 to 10. Now, less than 4 PSA usually a benign condition causing the PSA, but for CA prostate usually more than 4 PSAs we are considered abnormal. Between 4 to 10 PSA, we are going for the PSA with free and total and their ratio. If their ratio is less than 18%, then we are going for the prostatic biopsy. If it is more than 18%, usually we are not going for the prostate biopsy. We follow up the patient and repeat PSA after the 1 month. If it is decreasing trend, then we are not going for the prostatic biopsy. If it is increasing in the PSA, then the previous 1 month before 1 month PSA, we are going for the prostatic biopsy. In the prostatic biopsy, we are usually taking the 6 cores from the prostate gland, from the right lobe of the prostate, 6 from apex, middle and base, and the left side from the apex, middle and base. Sometimes this biopsy comes negative. In that cases, we are going to for the saturation biopsy. We are taking the more trans-guided prostatic biopsies if we are more suspicion of prostate cancer. This is come down to diagnosis of the prostate cancer. If the prostate cancer patients, if diagnosis is a CA prostate, then we can plan for the treatment. There are multiple modalities available today's scenario. First is the watchful waiting, second is the medical treatment, third one is the surgical treatment. In the watchful waiting, if the patient is elderly age group, more than 75 year of age group, and their life expectancy is less than 10 years, and they have suffering from the other comorbidities like diabetes, hypertension, ischemic heart disease, or some stroke problems, CVA. In these patients, we can closely watchful treatment we are giving. We are regularly check up the patient, their symptoms and the PSA. If it's sudden rise of PSA or patient symptom develop bone pain, then we can start the treatment. Otherwise, we are going for the watchful waiting. Apart from that, second treatment is the medical treatment, in which the patient PSA is high and the patient disease is locally advanced, or already it metastases to the bones or other organs. We are starting the medical treatment, in which we are giving the hormonal treatment. In the hormonal treatment, because the CA prostate is depend on the hormones, that is testosterone hormone that is secreted by the testis. So that can be, we remove this testis hormone by giving the some injections, that is LHRH agonist. That LH hormone secreted from the brain and goes to the testis and secrete the testosterone. We are block this LH hormone from the brain in form of LHRH agonist or a antagonist, so that testis hormone goes down, so that prostate cancer is stay into the prostatic area, but it is not spreading and it is not growing. Apart from that, if this primary treatment is hormonal treatment is failed, we are giving some receptor blockage. Apart from that, we are going for enzalutamide or other chemotherapies in the later stage. Third part is the surgical part. In the surgical part, we are going if the patient is elderly age groups and the disease is progressive. In that case, we are giving the hormonal treatment in form of removing both the testes instead of giving the injection, that is LHRH agonist. Apart from that, the patient is younger age group. If the patient is younger age group and the disease is confined to the prostate, and though no local spread or no metastasis is there, and PSA is less than 20, in that situation we are going the radical prostatectomy. In the radical prostatectomy, we remove the whole prostate from the bladder neck to the sphincter of the external sphincter of the urethra, and after that we are join this bladder neck to directly to the urethra. But there is a complication of this surgery is higher, like incontinence of urine, erectile dysfunctions, and obstruction of the urinary flow in sometimes. But this is the mainstay of treatment in the young patient with the less PSA of less than 10, and the Gleason score that is arising from the prostate biopsy, it should be 7 or less than 7. This is the ideal and permanent treatment. Apart from that, some patient have a locally split. In that situation, we can give the radiotherapy after radical prostatectomy or after giving the hormonal treatment, or simultaneously with hormonal treatment. The radiotherapy is also be considered in a locally advanced tumor. But the disease is progressive, but we should follow this patient regularly, because the prostate cancer is usually patient is will not die because of the CA prostate, because patient dies from other problems. So CA prostate disease is very slow progressive, and it will, when patient usually first diagnosed with CA prostate, their life expectancy is more around 8 to 10 years in initial stage. So you don't worry if your PSA is high, your doctor is saying that your dairy finding is abnormal, you are going for the prostate biopsy. You always go with the prostate biopsy if some symptoms or some digital rectal examination and PSA is high. In that situation, we can diagnose you early and we can treat with radical prostatectomy or some other medical treatments. Now we should come to the follow-up. Usually we are follow up the patient PSA for initial 1 year, 3-monthly PSA. The PSA goes less than 0.05 or less than 0.5, we are considered as a disease is under control. The PSA is rising after the some years, then we should consult a urologist to further treatment. It may be require a second line of the prostate cancer treatment or third line like a chemotherapy. But The disease itself is not giving much harm, as the persons are thinking this is a cancer, we should die because of cancer, but most of the patient in our practice not die because of the CA prostate. If any query, you can write down on our Facebook page. We can reply within the same day. Thank you very much.